Well, good morning, everyone. This is Keith with Positively Osceola, and we are here for yet another episode of our Osceola Matters live. And, we have some extraordinary guests that we are blessed to have on this show and so many of the other shows that we do at Positively Osceola. But certainly, this is a huge honor today as we're going to welcome one amazing physician that has recently joined Orlando Health St. Cloud Hospital, and that's a big addition. For sure, that'll be Dr. David Melendez. We're going to welcome him into the show right now. And there he is. Welcome, sir.
Welcome, Keith. Thank you for having me.
It's great to have you here. And like I said, we'll chat for a few seconds and let a few people pop on and figure out that we're talking this morning. And so how's your Tuesday going so far?
Going well. Ready for it.
And you get up saying, oh, my gosh, this is that day those guys are going to have me on that show.
No, I'm happy to be here. Thank you for having me.
That's great. Well, so like I said, we'll chat it out for a little bit. So it looks like we're about to head into the summer months pretty quick this year.
Yes. I can't wait for that, actually.
Yeah, me too. The heat doesn't bug me.
No, it doesn't bother me either. And it's been a tough year, but that hopefully the summer will be better.
Yeah, it's interesting how so many of these kind of interviews you mentioned before we were starting. That maybe we'd be able to do an actual real like face-to-face discussion someday.
Yes, I can't wait for that. I'm sure that will come. That will become very soon.
It will. It's heading that way. So let's go ahead and make this official. I'll do the little intro thing I talked about, and we'll start having a talk.
Absolutely.
Well, again, I welcome you here, and I realize, Dr. Melendez, how busy you are, and so that you would take the time this morning to say hello and to chat with us on Osceola Matters, we certainly appreciate it.
No, thank you. It's an honor to be here and chat with you about all these issues, and for me, it's also very good to be here. I'm happy to do this.
That's great. Well, let me introduce you real quick and just tell people a little bit about you. Then I'll ask you to do the same on a larger level. So. Obviously, we're with Dr. David A. Melendez, recently joined Orlando Health Medical Group Urology and is based at Orlando Health St. Cloud Hospital in St. Cloud. Dr. Melendez is experienced in robotic and laparoscopic surgery, including management of prostate and kidney cancers. He has also extensive experience in the management of stone disease, benign prostatic hyperplasia, erectile dysfunction, incontinence, and many other general urologic issues. So, we thank you again for being here. So go ahead, just kind of tell us about you and tell us about how you came to Orlando Health St. Cloud Hospital and what you do and how you serve the community.
Yeah, well, I came from New York. I trained in St. Louis for residency and New York for fellowship. And originally I was born in Spain, but my parents are in Spain and Puerto Rico, so I have both backgrounds. I speak Spanish and English, and I moved all my family here for this job. We moved in early December, and we've been here since then, and so far we're loving it. And the moment I got the opportunity to join St. Cloud Orlando Health Hospital, I knew it was going to be good. There was a big need for to bring more urologists in the area, and we're serving that purpose. So I'm happy to do that.
That's great. Well, again, welcome. It's love that you're speaking Spanish. Of course, it's a huge part of what Osceola County is all about. It's a very diverse culture. One of the reasons that my wife and I love it here, it's just filled with so much different culture and so many different, backgrounds brought into one place. I love that about Osceola County. So
yes,
it's wonderful. And so officially welcome to St. Cloud. So why don't you tell us a little bit about maybe what you do at the clinic and what you do in Orlando Health St. Cloud Hospital, and maybe move towards men's health in general, if you would.
Right. Well, as you well said, I'm a urologist. I take care of every single aspect in urology. I train and specialize in men's health and prosthetics for erectile dysfunction and many other issues like incontinence as well. But we take care of every aspect of urology in our office at St. Cloud Hospital. Kidney stones, prostate cancer, kidney cancer, any issues in the urological tract, which includes the kidneys, the uterus, the bladder, then the more genital area as well. So we see a lot of diverse pathology. We see kidney stones, a lot of kidney stones in the area.
Right.
We see a lot of other any other issues that are related with the urological tract. So we can take care of all those things. We do a lot of preventive work as well in men's health, and so that's basically the big old aspect, the big picture of everything I do over there. So far, I am the office 3 times a week: Monday, Wednesday, and Friday, and we are operating Tuesdays and Thursdays. We also have access to the Dr. Phillips Hospital for bigger cases and things like robotic surgery. So we're able to do that over there for now.
So you mentioned earlier when we were talking prior to going live that Men's Health Month is in June. So,
Correct.
so what would you say to folks, typical patients that you see, and I kind of referenced also myself. So I'm in my 50s. What would you say to the audience that would be a target patient that might that you might say, look, these are the things you need to be concerned with. These are the things that you may want to consider doing now in a preventative measure, or what would you speak to that audience as we're moving towards that Men's Health Month?
Of course. So that's a good question, and I appreciate that because that's important. As you know, I always say the analogy. Women, for example, they go to their checkup every year because when they're early in their 20s, 30s, they get their checkup. They check for HPV. They check for many other things, right? The Pap smear, all these things. We don't have that. Men usually, unfortunately, we go when there is a problem, and sometimes when the problem arises, sometimes it's a little late to deal with it. So then we have to take um, legal, other measures instead of preventing the problem. So we're trying to kind of bring a solution for that, and we're trying to promote prevention among men of our age group, even starting earlier, like in the 30s and 40s. One of the things that we notice as we age, we lose a little bit of ability to be more active, a little bit of more initiative for everything in life, not just erectile dysfunction or sexual function, but among many other things. So one of the things that we check when somebody approaches 50, we do a set of labs. We make sure that your blood levels are fine, your electrolytes are fine, your testosterone is fine, and all those things. Men, of course, between 50 and 75, the risk of prostate cancer is increased. So we check for PSA, which is a prostatic specific antigen, and we want to make sure that it's in appropriate levels. When it's higher than 4, we are concerned about possibility of high risk of prostate cancer. So we want to check for that as well. And then we have basic numbers of all those levels. That way we can target if there's any problem or any issues arising, and we can take care of those early in time if they appear. Also, we enter into conversation with our patients about healthy lifestyle habits. How you're eating, how you exercising, what are you doing for exercise, and what are you doing in your diet. And there is a lot of these aspects play into role in our health as a whole. Like I always say, life is a gift, so we got to take care of it so we can enjoy it for many years, right? So that's the whole point of this.
All right, and maybe this is more of I'll make it a personal scenario. So do you find that more patients are coming through their primary care physicians and then referred to you as part of that, as part of what that the primary care physician is recommending? Or do you say that people, when they hit a 50-year-old time place in their life, do they just directly contact Orlando Health and just go straight to you?
I see both. Sometimes people go to the primary care for the usual care, and sometimes people do their checkups. They check like we were talking before the show started. We were talking about it's like a car engine, right? We gotta do like the check the oil from time to time, right? Every 3,000, 5,000 miles. This is kind of the same thing. We're gonna make sure that our engine is working right and is working properly and is well taken care of. So, and it's as a whole. It's not only again, not specifically talking about sexual function. It's just as a whole as well, because as a whole affects everything in our bodies. So if you're a patient, if you've been checking with your primary care provider and something comes up as a red flag or something is elevated, maybe you have an elevated PSA, maybe you have a low testosterone, maybe
Right.
you have something different, maybe your cholesterol is high and that is affecting everything in other organs, including genital or urological organs. He can refer to us or he can refer to me and we can see what is the problem and we can engage into a more personal and private conversation about any other issues that may be going on. And that's when we can target those issues and kind of check and okay, this is the problem, let's go and do this, let's go offer and investigate more if it's needed, or offer different treatments and options for taking care of that problem. But we see self referrals as well. We see people that haven't gone to the primary care from a long time, and sometimes they're starting having problems, urinating. Maybe they're urinating a little differently, go to the bathroom more often, and they're thinking that that could be a problem related with the prostate. Maybe the prostate is enlarging, or some other problems that that may arise in that for that issue. So we see both type of patients. They come self refer or refer for the primary care providers. Both are perfectly fine as long as they can check and take care of themselves. That's what we are promoting.
And I mean, I think you're spot on. And as a guy, I can attest to exactly what you said. I know my wife is much more proactive in
Hmm.
her healthcare. I'm always worried that she's not going to take care of those specific tests, so I'm the reminder if she needs it, because I love her, and and she's always encouraging me to do the same. But it always seems like it's much more challenging for a guy to say, "Look, I'm gonna get out in front of this and make sure I've got everything going the right way." You mentioned erectile dysfunction, so maybe we should focus a little bit on that. That seems to be one of the services you provide heavily. So let's target that a little bit, if you would mind sharing a little more on that.
Sure. Like that's part of my specialty. I did a fellow in New York, and I trained in men's health and prosthetics. So I did a lot of minimally invasive techniques and surgery for erectile dysfunction. But that's not only the only treatment. We have many other treatments for that. But the most important thing for us and for me is to find out what's the problem. Sometimes it's a psychological issue. Sometimes it's a block. Sometimes it's a performance anxiety issue. Believe it or not, people sometimes believe that that's just the only problem that's going on with them. But when you investigate, then you find out other issues. It is very interesting, but sometimes erectile dysfunction can be the first sign of cardiovascular disease, and not a lot of people know that.
Right.
And some people that don't exercise too much and they have a lot of stress and anxiety. Hey, that's very common these days, right? We're going through an era, through times that very anxious for everybody. People is anxious to go, outside, to be with people, to be with family, to be with friends. And we've been through tough year. A lot of loss, a lot of loss of everything. Lives, jobs, um, personal gain, everything. So there's been a lot of anxiety out there and over the last 16 12 16 18 months. So we reflect that. That's it. We're seeing this in our patients. But like I said, the most important for me is to find out what's the problem, what's the cause. Because believe it or not, sometimes it's just a matter of adjusting diet, adjusting other levels in your body, adjusting, your lifestyle, exercise, promoting exercise, and those behavioral and lifestyle changes can take you, a long way, and avoiding problems in the future. Now, sometimes other patients, like patients are diabetics, have more risk for that, for
Right.
erectile dysfunction. So sometimes it's a matter of see what is, if it's something that is permanent, and then we can bring a solution for that, and then investigate, try to come with a balance, and then working also with their primary care doctors, the doctors that have been taking care of these patients for a long time, and see if we can come with a solution together for the issue.
So as I'm sitting here listening to you, and thank you, this is honestly great information. What hits me is that I just feel like I'm undereducated in the area, and so I think we get into this guess place,
Yes.
and whether that's a pride issue or just maybe if I don't find out, everything's going to be okay. But that's never a really great solution. So what would you recommend on that? Somebody who's listening to today, or even to myself. So what's step number one to talk about having a consultation with you? How does that work? How does that move forward?
Well, you can talk to your primary care provider if you have one, and I encourage you to have one if you don't have one. and they can contact our office, and we can make an appointment with you and see what's the problem or what's the issue, what is bothering you. And if we need to investigate, we have all the tools for that. And once you come to our office, we just engage in an honest and personal conversation about all your issues and see how we can help you. And then make sure we can target all those check boxes that we as a man, we need to make sure we can cover. Make sure that your cholesterol is fine, your blood levels are fine, your PSA is on their normal limits, and there's nothing wrong with it. There's no blood in the urine or anything like that. So, which is that's an important topic. Blood in the urine. If you ever see that, you got to go to the urologist immediately.
Right.
That's usually a sign of problem already occurring. So we want to prevent that. Sometimes we don't see it, right away, and then we can catch it just with the urine analysis. We can see microscopic blood in the urine, and we can investigate more and see why that's happening. Sometimes a stone higher up in the system. Sometimes it could be a sign of a tumor arising, which is the worst thing. But it's not the end of the road. We have tools and we have capabilities to work with all that and bring things to a solution, help with the problem.
Let's talk about that for just a second. I know we've got a few minutes left. So
Sure.
The technology in development must be amazing now as your practices, as opposed to say 10 years ago, even 5 years ago. Why don't we talk a little bit about some of that technology, the robotic side of that, if you don't mind?
Yeah, no, absolutely. I mean, robotic surgery is one of the things that we have, things that we offer through Dr. Phillips Hospital as a partner with Orlando Health and St. Cloud Hospital.
Cool.
It's been out there for many years. It's been out there probably for more than 20 years. But robotic surgery allows us to have minimally invasive technique to take care of patients that have, for example, prostate cancer, and to have kidney cancer, or sometimes an obstruction in the pelvis, which is a part that drains the kidney into the urinary tract. So it allows us to perform these surgeries with minimally invasive techniques, faster recovery, less time in the hospital, and less side effects as a complication after the procedure. So that's one of the things that we can do. But not only that, we can also, besides the robotic surgery, we can also investigate if somebody has an elevated PSA. We can investigate with an MRI. We can investigate with a prostate biopsy to make sure that patient doesn't have prostate cancer. So those are very important tools nowadays that we didn't have years before. Now a lot of patients get an MRI of the prostate. It's a very, very sensitive test that all urologists and everybody in the urology community is using, sometimes even before biopsy, because it has demonstrated a very, very sensitive ability to detect lesions that could potentially be cancer, and allowed us to do a target biopsy fusing MRI images and ultrasound images in real time. That's another technology that we have developed over the last 5-10 years, and right now almost everybody is using it. So we have it here in Orlando Health, and we can offer it to our patients. So we're happy to do that. Then brings you back to one of the topics that we're talking before, and I think you mentioned about that we as a man kind of fell behind, and I wanted to mention this. Sexual function and erectile dysfunction, for example, in our community, Hispanic communities, it's a taboo, right? People don't like to talk about it.
Right.
I try to promote that change. I know we had a lot of topics in our heads and in our lives that we kind of we're very sensitive to it, and it's a personal thing. But I promote people to talk about it in an open discussion with your doctors, because we can prevent problems before they become a bigger problem.
No, that doesn't get said any better than that. And again, before I forget to say this, when we do get to June, and it won't be far off, it won't be long before it's here. You would certainly we'd be honored to have you back again, and just further discuss this. I think it's a big point, and I really enjoyed the fact that we're talking about how men, including myself, how it can be challenging to remember in everything that we're doing to make sure our healthcare is top of the list, making sure that we're being proactive. With such technology, with such experienced doctors such as yourself in the area, it's not a far drive anymore. I mean, the way Orlando Health has put this together, there are Orlando Health facilities throughout Central Florida that are easy to get to, and easy to speak to people such as yourself to ensure we have a healthy and long life. So I hope you'll come back on in June and we can discuss this further for sure.
Oh, absolutely. I will be happy to do that anytime. I'm happy to be back in your show. Again, I enjoy doing this, and I enjoy being part of the community. I think, we, like I said, there's not that many of us out there, and the community, St. Cloud, Osceola County, and Kissimmee, I'm happy to be part of that community, because I think there's a big need for all of the providers and all the specialties, but urology it's a high demand right now. So I'm happy to be part of it, and I'm happy to be see patients in our office over there in St. Cloud, and they can contact us. We can make an appointment, make sure that we can help them.
So one last time for those who may have joined us in the middle. So we're obviously we're talking Orlando Health. So how does somebody get a hold of you, or how why don't you go ahead and craft those hours for us one last time before we say goodbye?
Sure. In the office right now, we're seeing patients every Wednesday and Friday. In Buttergreen Avenue is the Medical Pavilion building of Orlando Health, and St. Cloud Hospital is the new building that is over there in Buttergreen Avenue. We're going to start seeing patients again on Monday. So we'll be hopefully Monday, Wednesday, Friday.
Awesome.
And then we're doing procedures in the operating room over there in St. Cloud every Thursday and every first Tuesday of the month. We also have the possibility to bring patients to Dr. Phillips for any robotic procedure or any other procedure that we don't have the capability in St. Cloud for now. Eventually, hopefully we will have it down the road. But for now, we're using Dr. Phillips for any robotic procedure or any interventional radiology procedure. We use Dr. Phillips, again with the partnership with Orlando Health. So that's what we can offer, and we have all the tools to do it. So we're happy to do that and bring that into the community through Orlando Health St. Cloud.
And that's a big win, obviously, if you're participating with Orlando Health, that those extraordinary facilities are also accessible. It's wonderful. And, we say this a lot, Orlando Health's not just in the community. You're certainly part of the community, and we were and have been very honored to be able to discuss these things with you. And it's about keeping people healthy and having long and prosperous lives. So, again, Dr. Melendez, we thank you for spending time with us today.
Keith, thank you so much for inviting me. It's been a pleasure and an honor to be here. And I'll be happy to come back during June anytime to be ready for Men's Health Month.
Yes, count on us inviting you. Again, we're with Dr. David Melendez, who recently joined Orlando Health Medical Group Urology, is based at Orlando Health St. Cloud Hospital. And this has been a great conversation. And you can bank on it. We're going to reach out to you guys again and ask you to come back and discuss further what we discussed today, okay?
Absolutely. Anytime. Thank you, Keith.
All right. Again, this is Keith with Positively Osceola, along with Dr. David Melendez from St. Cloud, Orlando Health Medical Group Urology at St. Cloud Hospital. Together, we're making a positive difference in and around Osceola County. Have a great day.
Thank you. You as well.